Dr. Lyons, as women move into their mid-40s and early 50s, we all start to notice changes in our faces. And I don't think many of us understand what's really happening. Could you explain what happens to women's faces at this stage?
Okay, there are two main factors. One is age, obviously. With age, fat goes off the face primarily. If you lose weight, the fat goes off the face. Okay? What we're aiming to do is restore the contour and the volume in the face. There are lots of ways of doing this. Okay? You can use dermal fillers, you can use plasma transfer. The ultimate treatment is fat transfer because it's very safe, it will last you years, and there are no complications, and you can put it in places in the face that you cannot use other treatments for. So we can treat under the eyes, the cheekbones, around the mouth area, the jawline, virtually everywhere.
So can you use fat transfer to re-engorge the lips?
You can do. The lips are a very tricky area, a bit like underneath the eyes. It's one of the trickiest areas of the face to treat. There is still very much a place for fillers on the lips because you can produce a really nice sharp outline and create the cupid's bow with great precision. If there's lots of volume loss on the lips, fat transfer is great for that as well. However, there's also a place for the dermal fillers which produces very good results.
So would you be using fat transfer instead of Botox?
No, Botox is a completely different story. Botox works well for the upper face, from here on up. Volumization for the lower face, completely different thing. Botox is great for ironing out the fine lines and the wrinkles on the upper face, be it the frown lines, the forehead, crow's feet around the eyes, works brilliantly. I doubt anything's ever going to replace that. The lower face is much more complex and deals mainly with loss of volume. Under the eyes, cheekbones, nose to mouth lines, jawline, that's where it comes into its own.
Okay, so how many people are doing this procedure in the UK that you know of?
The fat transfer facial procedure, as far as I know, less than 20 at the moment. What we're doing, which is what most people want, is we're taking a small amount of fat from the inner thighs with no side effects, taking that bit and re-injecting it back to where we need it most.